And growing up in a family as large as mine, we got a problem, we deal with it. You got an issue, resolve it. I was not accustomed to terminology, and I wasn't too receptive in receiving it because it was someone else's diagnosis. It wasn't touchable. It wasn't real. Encountering Mike Sanchez, he gave me the support and the guidance to get through the place where I could start to absorb it and say, yeah, it possibly could be me.
I mean, I've been doing this for so long, I often think of why I do this. It's great to be in a position where I can live my ideals.
Using a team-based approach is really, I think, beneficial because they have more ways to access the team than access me. I said, you need to see radiation therapy at Anschutz, but they don't have a car. I don't have the expertise for that.
If your goal is just to get people into primary care, oh yeah, we can have someone do that. But there's so much more. I think the difficulty with the system we have set up is we need to quantify everything. And how do you quantify trust? How do you quantify a feeling of loyalty?
Everyone likes to be able to access care from people who can speak their language, who may look like them, who have similar world experiences as they do, and that isn't what our workforce looks like today. The whole idea behind voluntary credentialing and the registry process was to provide some promise to employers that the people that they're employing in these roles possess the skills and the knowledge that they need to provide care coordination to patients. It also provides patients with some assurance that the people that are helping with their care coordination are competent, and I think that's very important in terms of patient safety.
I think the registry gives a little more validity to navigators. I think it'll help us be recognized as professionals. You have to have met certain criteria to be on the registry. So I think that can give employers a little comfort, like, okay, knowing that they have this baseline of skill and knowledge that they can work with. And the reality is we're cheap.
But they bring a lot of positive things into the healthcare field because they prevent readmissions, because they prevent emergency department visits, because they improve their compliance with their medications.
Accessing healthcare can be very difficult. I don't see that improving anytime in the near future. So I think that health navigators are here to stay, and we know that they reduce barriers and improve outcomes and reduce the cost of care.
And going through the exercise of seeing a human being across from me, not a diagnosis, not a status, but just a person. I think that's a place of honor, and yeah.
He's a main artery, and if it was more navigators like himself, it would make a substantial amount of difference.